Dementia is a neurological condition, usually of a chronic and progressive nature, that leads to the deterioration of multiple cognitive functions, such as short and long-term memory, thinking, judgment, learning and calculation skills, but also orientation and language. The loss of brain function reaches the point of interfering with the life and daily activities of the person who suffers from it, causing serious physical, psychological, social, and economic repercussions, which inevitably also affect those who take care of them. Dementia is not a single disease, but rather a collection of signs and symptoms caused by a variety of diseases and injuries that primarily or secondarily affect the brain, such as Alzheimer's disease, stroke, head injury, or the abuse of alcohol for a long time. The resulting degeneration or death of brain cells, and therefore of neural connections, causes a decline in cognitive functions and therefore an increased risk of developing dementia. The type and intensity of dementia symptoms vary depending on which part of the brain is damaged. However, there are some common early symptoms that can appear before a diagnosis of dementia and which are often overlooked or confused with other conditions. Let's see what they are. Losing track of time. Time perception is a fundamental element of human awareness, but there is still considerable uncertainty about how and in which part of the brain it is processed. What we know, however, is that temporal perception is influenced by age, cognitive factors, and the biochemical conditions in which the body and brain find themselves at that moment. Emotions, for example, greatly influence the perception of time. When we are having fun or in the company of friends or the person we love, time seems to pass quickly. While when we have to do something that bores us or we don't like, the clock seems to stop, and every minute seems like an eternity. In the case of dementia, among the first symptoms we find a loss of cognition of time. It all starts with small alterations. For example, we no longer know what day or what month it is until we know if it is morning or evening, day or night. You cannot read the face of a clock or understand the exact position of the hands of the clock because the part of the brain that deals with this type of reasoning is damaged. Getting lost in familiar places. The inability to orient ourselves makes us lost even in familiar places and prevents us from finding our way back home. We begin to no longer recognize the city, the neighborhood, the house where we have lived for years, until we are unable to remember the layout of the rooms and the position of our bed. Wandering is a fairly common behavior among people with dementia and leads them to wander around the house or around the city, whether it's out of boredom, despondency, or simply because they forget what they wanted to do. A person may leave their home to go to the supermarket or shop and then forget where or why they wanted to go. It must have happened to everyone to enter a room with a decisive step to get something, but once we cross the threshold, we magically forget what we wanted to do. This is a phenomenon called the doorway effect and causes a temporary decrease in short-term memory after walking through a door, as our mind is exposed to a sudden physical change from one environment to another. This is a simple forgetfulness that is not related to a cognitive disorder or the onset of dementia. Within certain limits, memory lapses are normal, but if they start to occur frequently, it could be one of the first warning signs of dementia. Memory problems. Forgetting some things is normal, and it happens to everyone, especially as we get older. We may not remember where we put our keys or the name of the movie we saw a week ago. It is a physiological process that allows the brain to erase useless memories and make room for the most relevant ones. However, when you start forgetting appointments or important dates, recent conversations, or repeating the same questions over and over again, it could be a sign of the onset of dementia. Memory loss is in fact one of the first signs of the disease that is noticed by family members or doctors and is due to damage in the brain areas involved in creating and retrieving memories. Speech problems. In the early stages of dementia, we find that we have difficulty focusing on the train of thought or in evoking infrequently used words. Our vocabulary becomes limited, and the language will be slightly impoverished in terms of information content. Simple expressions or set phrases are used. As the disease progresses, there will be some uncertainty about the syntactic construction of the sentence, and anomalies will be more frequent. It is a deficit in the naming of objects, where we can recognize them, but we do not know how to define them or call them by their name. The sensation is that of always having the word on the tip of the tongue, and during the speech, there are long pauses in an attempt to search for the term that we do not remember. Mood swings. We are all subject to mood swings, but in case of dementia they happen suddenly and for no apparent reason. We speak of emotional lability and indicate a mood alteration following the slightest emotion, which greatly disturbs the patient. He gets irritated so easily, gets depressed and cries, while in other cases he gets pleasure and starts laughing. It is often an early symptom of dementia, as well as being characteristic of the advanced stages of multiple sclerosis. Emotional lability is the result of a disturbance in the control that the higher cortical levels exert on the thalamus and hypothalamus, two structures of the central nervous system. In the initial stages of dementia, but also in the more advanced ones, changes in personality can also occur. A person who has always been quiet and peaceful can become short-tempered, suspicious, and distrustful, so much so that loved ones around him find it difficult to recognize him. As brain cells die, unusual personality traits or behaviors develop, such as anxiety, aggression, apathy, paranoia, or depression. Other early symptoms of dementia include impaired judgment and difficulty making decisions, as well as vision and balance problems. Dementia is not a normal consequence of aging, but one of the many symptoms of a disease that affects the brain and which involves the progressive degeneration of the cognitive abilities, emotions, and behavior of the sick person. Identifying the symptoms of dementia when it is still in its early stages allows for an early and accurate diagnosis. In this way, it is possible to provide the patient with treatment and assistance appropriate to his medical condition, as well as informing the family members who will be caring about what to do and how to behave towards the person with dementia.